Welcome to the updated Dr. Bernstein podcast. Please check the description for the original sources, and all content is general in nature and should not be considered medical advice. So today, we are going to take a deep dive into some really interesting research on type 1 diabetes and pregnancy, and we'll compare it to, the bedrock principles laid out by Dr. Bernstein and kind of see how modern science is stacking up against his established views.
Yeah, it's a fascinating exploration, especially given the kind of explosion of research in this field. If you look at PubMed studies just over the last decade, the increase is staggering. We're talking about like a steep upward trend peaking just last year.
Wow, it's like the world is finally recognizing the unique challenges and opportunities in managing T1D during pregnancy. And speaking of game changers, this research really highlights how technology is revolutionizing care, which brings us to continuous glucose monitoring, or CGM. Dr. Bernstein was all about that tight control, and CGM takes it to a whole new level, right?
Absolutely. While Dr. Bernstein advocated for meticulous blood sugar logging through traditional, finger pricking, CGM provides this constant stream of glucose data. So this not only eliminates the need for those frequent finger pricks, which, can be burdensome during pregnancy, but it offers a much clearer picture of glucose trends throughout the day and night.
Yeah, it's like having a window into your body's inner workings, 24/7. But here's where it gets really interesting. One 2023 study found that CGM use alone, while a massive step forward, still wasn't enough for many women to consistently hit those ideal glucose targets, especially in late pregnancy.
That's right. And I think, this finding really emphasizes that technology, while powerful, isn't a magic bullet. It underscores the complex interplay of hormones, individual physiology, and even the placenta's growth, all of which can impact blood sugar regulation during pregnancy.
It seems even with incredible advancements in technology, Dr. Bernstein's emphasis on understanding the individual's response and tailoring treatment accordingly, it remains incredibly important.
Precisely. And this is where things get really futuristic. Researchers are exploring how automated insulin delivery systems, or AID systems, can build upon that foundation of CGM. So imagine a system that takes that constant glucose data from the CGM and uses it to automatically adjust insulin doses in real time.
It's like having an AI co-pilot for your diabetes management, constantly making those fine-tuned adjustments to keep your blood sugar in check. It definitely seems like the next evolution of Dr. Bernstein's tight control philosophy.
It is, and the research on AID in pregnancy is incredibly promising. For instance, the 2023 AIDAC trial showed remarkable improvements in glucose control for pregnant women with T1D using these systems.
Wow, that's incredible. But I imagine even with this advanced technology, it's not a set it and forget it solution, right?
You're absolutely right, and this is where another one of Dr. Bernstein's core principles comes into play, the importance of patient education and active self-management. Even with AID systems, women still need to be actively involved in their care.
Right, so it's still about understanding the nuances of carb counting, meal timing, and how all these different factors can influence blood sugar levels.
Exactly. Successful use of AID, even in the future, will still rely on a strong foundation of diabetes knowledge and self-care practices. And this is an area where the research really emphasizes the importance of healthcare providers, stepping up as educators and partners in this process.
Absolutely. Providing that guidance and support can make all the difference. It's interesting how this research highlights that there's so much more to managing T1D in pregnancy than just focusing on those glucose numbers.
Absolutely. And while Dr. Bernstein's work did emphasize tight glucose control, he also recognized the importance of a more holistic approach. And this is where the latest research aligns beautifully, particularly when it comes to mental health.
Yeah, I'm glad you brought that up. The research really underscores the immense emotional burden that women with T1D often carry during pregnancy.
Yes, the constant pressure to achieve perfect blood sugar, the fear of complications, just the sheer volume of information and decisions, it can really take a toll. And this is where I think Dr. Bernstein's advocacy for individualized care is so critical.
Right. It's about recognizing that each woman is unique with her own, medical history, support system, emotional landscape.
Exactly. And that's why the research emphasizes the need for a personalized support systems
Yeah.
that go beyond just the medical management. And this could include access to mental health professionals, support groups, or even just, online communities where women can connect and share their experiences.
Yeah, it's about creating that safety net of support, right? To help women navigate the emotional roller coaster of pregnancy with T1D.
Precisely. And this holistic approach extends beyond just the mother's well-being. One of the kind of, I think, most thought-provoking aspects of the recent research is its focus on the long-term health implications of maternal diabetes for the child.
It's something we touched on earlier, but it's worth, diving into a bit deeper, I think. We're talking about the increased risk of the child developing conditions like ADHD, ASD, and even diabetes later in life.
That's right. And while, Dr. Bernstein's work focused primarily on adult diabetes management, I think he would be fascinated by these findings. It really broadens the scope of responsibility, reminding us that the impact of diabetes during pregnancy can, echo through generations.
Yeah, it's like we're starting to understand the ripple effects, how those 9 months can have a lasting impact on the health trajectory of the child.
Exactly. And this underscores the need for ongoing research and proactive care, not just during pregnancy, but across the lifespan of both mother and child.
Right? It's about recognizing that this isn't just a 9-month journey, but a lifelong commitment to health and well-being.
Absolutely. It requires a shift in perspective. Instead of solely focusing on, managing diabetes in the present moment, we need to think about how our actions today can influence the health of future generations.
It's a big responsibility, but also an incredible opportunity to make a real difference. Now, while a lot of the research focuses on technology like CGM and AID, one quote really stood out to me. It talked about the need for, and I'm quoting here, approaches to improve self-care. It made me think about how, how can we empower women with tools beyond just the technology?
That's a great point, and it ties back to something we discussed earlier, the importance of patient education and self-management. But it goes even deeper than that, right? It's about recognizing that women are not passive recipients of care. They're active participants in their health journey.
So it's about providing them with the knowledge and support they need to make informed decisions and to advocate for themselves and their babies.
Precisely. And this is where I think Dr. Bernstein's legacy really shines. He was a staunch advocate for patient empowerment, believing that, knowledge and self-advocacy were essential for successful diabetes management.
It's about empowering women to take ownership of their health, not just during pregnancy, but throughout their lives.
Exactly. And it's about recognizing that true well-being encompasses more than just, physical health. It's about nurturing emotional resilience, managing stress, cultivating a positive mindset.
Right. It's like taking that holistic approach to care,
Right.
addressing both the body and the mind.
And that brings us to another, I think, important aspect highlighted in the research, the need for personalized care. While Dr. Bernstein advocated for individualized treatment plans, the latest research takes it a step further by exploring how factors like genetics, lifestyle, even the microbiome can influence diabetes management during pregnancy.
Wow, it's like we're moving towards a future of precision medicine, where care is tailored not just to the individual, but to their unique biological makeup.
Exactly. And this is where I think the real excitement lies. By understanding these individual variations, we can develop more targeted interventions, optimize medication regimens, and even potentially prevent complications before they arise.
It's about moving beyond that one-size-fits-all approach to care, right? And embracing the complexity of individual health.
Precisely. And this personalized approach extends beyond just, medical management. It also encompasses lifestyle modifications, dietary interventions, even psychological support.
So it's about creating a truly comprehensive care plan that addresses all aspects of a woman's well-being, empowering her to thrive throughout her pregnancy and beyond.
Absolutely. And I think this is where the research offers a powerful message of hope. While diabetes during pregnancy presents unique challenges, by embracing these advancements in technology, research, and a holistic approach to care, women can look forward to, healthier pregnancies and brighter futures for themselves and their families.
It's like we're entering this new era of diabetes care, one that's defined by both, cutting-edge technology and a deep understanding of individual needs.
Yeah.
And, one area where I see both of these aspects kind of converging is in preconception care.
Absolutely. Dr. Bernstein was a firm believer in early intervention, and preconception care really embodies that principle. It's about optimizing health before pregnancy even begins, laying the groundwork for the healthiest possible outcome for both mother and baby.
Yeah, it's like giving those little ones a head start on a healthy life, even before they're conceived.
Precisely. For women with T1D, This might involve fine-tuning blood sugar control, adjusting medications, addressing any kind of pre-existing conditions, and really focusing on those healthy lifestyle habits.
So it's about proactive planning and taking those essential steps
Yeah.
to minimize risks and increase the chances of a smooth pregnancy.
Exactly. And while Dr. Bernstein didn't have access to all the technology and research that we have today, his emphasis on meticulous preparation and individualized care aligns perfectly with this modern approach to preconception care.
Yeah, it's really fascinating to see how his core principles continue to resonate with the latest advancements in the field. Now, before we wrap up, I wanted to circle back to something we touched on earlier, the long-term impact of maternal diabetes on the child. It's one of those areas where the research is really starting to reveal some pretty profound insights.
It is, and it's a topic that, while potentially concerning, also presents this powerful opportunity for us to make informed decisions and shape healthier futures for generations to come.
Right, exactly. Can you tell us a little bit more about what this research is uncovering?
Sure. One of the, I think, key takeaways is that the influence of maternal diabetes can extend far beyond those initial years of a child's life.
Yeah.
We're talking about a potential increased risk of developing certain conditions like, cardiovascular disease, metabolic disorders later in life.
Well, so it's not just about, like, immediate health outcomes,
Yeah.
but also about understanding how these early exposures might influence, long-term health trajectories.
Precisely. And while this research is still evolving, I think it really underscores the importance of a life course perspective when it comes to diabetes and pregnancy. It's about recognizing that interventions and support shouldn't stop at delivery, but should continue throughout childhood and adolescence to mitigate these potential risks.
Right. It's about embracing that more holistic and proactive approach to care, one that prioritizes not just the mother's well-being during pregnancy, but also the long-term health of her child.
Exactly. And, Dr. Bernstein was all about empowering his patients with knowledge.
Well-
I think he would be incredibly encouraged by this research because it gives us, more data, more insights, and therefore more power to make informed choices that can positively impact the health of future generations.
Yeah, it's like we're taking his legacy of patient empowerment
Mhm.
and expanding it to encompass the well-being of entire families.
Precisely. And that's an incredibly powerful thought.
It really is.
Yeah.
Well, I think we've covered a lot of ground today, wouldn't you say? We've explored the latest research on T1D and pregnancy, connected it back to those fundamental principles championed by Dr. Bernstein, and hopefully provided our listeners with a lot to think about.
I think we've achieved a great balance of information and inspiration today.
I agree. Thank you for listening, and remember to like and subscribe.